Hi, this is April Lee with Hope, Faith, and Thriving. I have a guest here today. Her name is Tanea with Finding Magic in the Madness. And I found her on Instagram, and she has a story to share and lots of very important information that I think is going to help a lot of people with long COVID and understanding long COVID, the symptoms, the treatments, the diagnosis, something I've never heard of called microclots, and also the healthcare system in Canada and how she's navigating that. So go ahead and introduce yourself and tell your story.
Hi, everyone. So I always like to make sure people know where I was at before I got long COVID. There's a lot of stigma around chronic illness and whether or not people are really sick and how sick they are. So prior to getting long COVID 4 years ago in March 2020, I was working in the psychology sector with youth and their families, particularly youth who have fetal alcohol spectrum disorder. Still attempting to work on my master's at the time and outside of full-time work. And then I was very, very, very active. So I taught spin on the side sometimes. I did a lot of weightlifting, swimming, hiking, you name it. We're by the Rocky Mountains, so gotta hike all the time. But basically what happened is we had gone traveling in December of 2019. Came home very, very sick. Nobody knew if COVID was in Canada yet. People were still sort of postulating if it was even going to be here. And then in my entire life, I've been working since I was 14, and I think I've maybe ever taken 2 days off of work. And I got so sick that I was non-functional for about 2 weeks. Took about a good almost 2 months to get fully recovered. But once I was fully recovered, it was 100%. I was swimming, biking. The day before I got long COVID, actually, I had walked my dog in the morning and done my yoga. After work, I had gone and done a full spin class, barely broke a sweat, went swimming after that. And then the next morning I woke up and just out of nowhere, sitting at rest, I couldn't breathe. I did everything I know for breathing practices and strategies, couldn't take a full clearing breath if my life depended on it. Went to go walk downstairs, almost blacked out and passed out, going down the stairs, not even up them. And then when I got downstairs, I found I was extremely lethargic, fatigued. I assumed I just had another bug or something. But it kept going on for a few days to the point where I felt like I was having the beginning of an asthma attack. So I'd finally gone to the hospital. The fast forward of that is in the beginning is a lot of people experience because nobody really knew what was going on. As much as it is common for a virus to leave lingering symptoms, we've seen it with mono and 1,000 other viruses over the centuries, but nobody was certain with that one. So they start sort of addressing symptoms alone because they would send you for lung tests. My lungs look fine, but they could see I can't breathe. My blood oxygen would be down. I would get sent for as asthma or allergy tests, those types of things, everything would show up fine. My blood work all looked perfect, but I was continuously less and less and less functional. Okay. We found about every 2 months a new symptom would crop up. So I started getting sort of hives and rashes all over my body that were inexplainable. I started getting something called petechia, which basically means your blood is sort of leaking a little bit. That's the layman's way of saying it, where the vessels are just weak. Very common when you're sick, but shouldn't happen when you're healthy. And it was happening every day for months and months and months, to the point where my entire shin would be covered in these blood spots. It was
like a prickly, almost like a prickly blood rash to the
Yeah, like polka dots, like someone took a pen and polka dotted your skin. Okay. And it was my whole shins were just covered in it, and my feet. And then it just kept progressing, like digestive issues, and my fatigue continuously got worse. Brain fog kicked in. I lost half of my hair in the span of like 2 months. I had 1 month where out of nowhere I gained 40 pounds in 1 month. Even my doctor was like, you couldn't eat enough McDonald's to do that. And we were healthy at the time. So It was very strange, but then when we tested thyroid and hormones, of course, everything showed up normal because long COVID, we've learned, really likes to hide. Um, and it just continued to progress from there. So by my second year, I had gotten so shut down. My organs were starting to shut down. Everything in my body was struggling. And my heart rate all of a sudden started to go really wonky. And we're talking my resting that's normally 60s and 70s, all of a sudden was in the 80s. And then a month later, the 90s, et cetera. And I had gotten to the point at my worst where my resting heart rate, calm in meditation, relaxed, my resting heart rate wouldn't go below 100, and it was averaging about 120.
Okay.
And so, and if I did anything, a lot of people who have POTS are familiar with this. Those not familiar, it's basically a syndrome where your posture and movement have a very wonky effect on your heart. So if I stood up or lifted my arm or the most minimal of movements, my heart would spike to 150. Some people are going even higher. And then what ended up happening in the second year is my fatigue got so bad that I was unable to be conscious for more than about 2 to 4 hours a day. I was literally, I didn't have a choice but to be asleep, to the point where if I tried to push through and function, I would fall asleep standing, doing something, talking to my husband. And my body had shut down so much that I couldn't go up a set of stairs. I went through a week where I had to stop in the middle of a staircase and have a nap to get up one. I had to crawl sometimes to get from room to room. Like my whole body was just giving out on me. And then we still don't know what happened. There's the thought that I may have had a stroke, waiting on getting in the testing, but the following months after my heart had gone that wonky, my brain fog out of nowhere crashed so hard that I was losing my language. A lot of people I know have dealt with this, same with people with chronic fatigue syndrome, where I was speaking flat out gibberish sometimes. I would think I had said what I meant to, and it apparently would just be gibberish that came out. I was slurring my words. I would struggle to, I mean, I have ADHD, but it was tenfold. There was no ability to concentrate, to the point where I always tell people my favorite stories where I microwaved ice cream once and I put our wraps away in the baking drawer, and it was those types of things happening 1,000 times a day instead of once or twice.
Okay.
And it was to the point where I was starting to struggle with spelling, which has never been an issue. I would not be able to put sentences together in order properly. And any sort of function just continuously deteriorated. So it took about 9 months for me to actually get properly diagnosed with long COVID. And that was because they obviously don't have a way to test for it theoretically. They kind of just rule everything else out. So they do all the heart and lung and blood tests and all that.
And what type
And
of doctor diagnosed you that personally? Was it your primary care?
It was a GP, but he had sent me to a lot of different specialists. And the one consistency that they all saw was how erratic my heart was. So the heart itself, structure, function, perfect, but the blood oxygen and the heart rate were just not rational, in relation to what I was doing at any given time, because we did all the stress tests and stuff. So they kind of put that together when they ruled out every other possibility. By that point, there was an awareness that long COVID was occurring. So they had diagnosed me with that. And then by that second year, it had gotten so bad that they had told me to go off work. I pushed through as long as I could. My clients were amazing. I kept cutting back hours and stuff. And by the end of the second year, I had to quit completely. So fast forward, I just had my 4-year anniversary with this, and we'll get into it a little more. I'm definitely a million miles ahead of where I was at that worst crash. I mean, I couldn't have put makeup on or clothing. I couldn't get out of bed without support. So we'll get into how we got from there to here, but it's the biggest thing I want people to understand is it's a whole body shutdown. Essentially, it attacks everything. The research right now the most common, I should say, seems to have a belief it's because it's attacking the blood in the veins primarily, which is affecting 1,000 other things in the body. But yeah, it's anybody who's going through this. There are some people who are lucky enough to only get 1 or 2 symptoms, recover within a year, but the majority are 2, 3, 4 years in and not getting better, or only getting mildly better.
Or they get to a stage and they stay there. Yeah.
They do, yeah. And it, even when you find little things that work, you might take a step forward, but it's like every time you get that step forward, your body's still taking 3 more backwards. So you're kind of, it's like you're climbing a mountain with weights hanging off of your back and you're never quite getting a full step in. So that's a big thing. And they are saying, like, at this point, there's about 200 different symptoms that they're finding are correlated with this based on how people's bodies are responding to it. So that's where we're at now. I've gone through a bunch of treatments and stuff that we'll get into, but that was the start of the journey. And it was a lot of specialists, a lot of doctors. I was lucky enough to have a doctor that knew me and knew if I was coming in, something was really wrong. Specialists who took me seriously, but I also know that the majority of people going through this are not getting that care or belief.
No.
Canada, the Public Health of Canada did a study where they actually asked people with long COVID what their experience has been, and they found about 40% of people in the country were getting gaslit and bullied, was the language that they used, by their doctors, and misdiagnosed. Misdiagnosed as in they have long COVID and they were being told that there's nothing wrong and it's psychosomatic or the usual.
Yeah. Oh yeah.
So that was sort of the beginning of that. So basically what happened is when I got to my worst and I had to quit work, I'm not okay with that. I love my job. I'm trying to build a dream career. I started hunting all over the internet. I think everyone needs to anyone who's not doing that, who's going through this. You can't even stay within your country with your search. You have to look everywhere because every country in the world has taken sort of a different approach to this. If you're in North America, you know that, especially in Canada, there's not much of any research happening. A lot of the research happening is sort of archaic compared to how far ahead some of the other parts of the world have gotten. And even in the States, there's some pockets of it that are great, but there's not much happening here. But around the world, South Africa, the UK, Germany, Italy, there are many, many countries that are putting massive funding into the research of this, and they're having some success in narrowing down what's really going on.
Okay.
Yeah. So, and that's, so you had talked about, you know, so I had found out I have the microclots, and basically where that came from is, based on everybody's lungs always testing fine, and based on low blood oxygen, in spite of that, they started noticing this must be vascular. There is a doctor called Dr. Vaughn out of MedHelp in Birmingham, Alabama. He worked with Dr. Pretoria in, I believe Pretoria is how you say it properly, in South Africa, and Dr. Laubscher, as well as Professor Douglas Cull out of the UK. My understanding is they got brought in the beginning to look at the autopsies because everybody was dying of strokes. And they were trying to figure out why we have 20-year-olds and 30-year-olds who are athletes randomly dying of strokes who seemingly have no underlying conditions. And what they ended up finding when they did the autopsies is something like 98% of the people who were dying from long COVID, the ones that have been sitting on ventilators, not getting help from them, they all had these clots in their system. And the biggest difference being, so a standard blood clot is sort of a, I'm not a doctor, so I'm just going to give you guys the explanations I've been given, but a standard clot is bulbous and just congealing blood, and it's a little bit less dense. A microclot is, you can think of it almost like a sticky plaque. So it's clots that form in strings, and then these clots tend to bind together like a ball of spaghetti. So they're very sticky, very hard to break apart. They like to attach to the vein wall, and that causes it to break down and damage the vein wall, prevents red blood cells and oxygen from getting into the system or developing or moving. And then, of course, the clots themselves take up space in the vein. And so not everybody with long COVID gets the clots. That's really important to note. It is, for some reason, primarily right now, 30 to 50-year-old Caucasian women of Northern European descent is what I'm told. They're trying to research that and understand it. But yes, so I had hunted around the world, called, I'm not kidding you, anal retentive dog with a bone. Called every person I could possibly get a hold of, emailed, you name it, any doctor, researcher, university that was touching this with a 10-foot pole. And Professor Kell was kind enough to get me in touch with Dr. Vaughn in Alabama. So in Canada, we have nothing here, nothing. Outside of going and get your standard heart and lung test, there is nothing being done for long COVID.
So let me ask
And
you this
so,
question. The
yeah.
doctor that diagnosed you was your primary, so he was able to diagnose, but he didn't have the resources to treat you?
Well, okay, so this is where this gets interesting, because so what he had done that was really successful. So a symptom, I always forget to mention this one because I don't experience it as much. So in my second year, after I got my vaccines, I got a lot worse. That's hit or miss for people. For me, my body did not respond well. And I got to the point where I started getting numbness and tremors and tingling through my whole body. I would wake up in the morning and my entire body would be like just shaking and vibrating. And it got so bad, I'd be woken up in the middle of the night. The tremors would be so bad. And my arms and my legs were completely numb and tingling off and couldn't use them for about 20 minutes after I woke up. Short version, after getting some blurred vision and vertigo and all these other things, they were starting to think I had developed MS from this. So they sent me for all the brain scans, no MS, brain looked really good, but the neurologist that I went to, she had seen quite a few patients who had long COVID. Now, keeping in mind in Canada, our wait times here, we may have free public health care, but that means low funding and our wait times are horrendous. So it took me something like 14 months to get into the neurologist. Yeah, it was horrific. And once I got in, she thankfully had seen enough people that she said, I know something functional is going on, but the structure's fine. So it's not MS, it's just mimicking it, which they're learning it mimics a lot of things. So they had started treating me with something called pregabalin, which is basically a seizure medication. It's for calming the autonomic nervous system. We know with a fair amount of confidence, long COVID really likes to overengage the autonomic nervous system and send it into that fight or flight overdrive. So they had started me on that. It went fairly well in the beginning, but I kept getting tolerant to the medication and we'd have to go up and up and up and up, and eventually started having side effects. So fast forward, they didn't know what else to do for me. They didn't have anything else they could do for me. So I had that Professor Khaled encouraged me to speak with Dr. Vaughn. They were kind enough. I jumped down to the States and they sent me the test so that I could go get it. I love that you guys have labs there where you can just walk in and get a lab. We can't do that here. It's wild. Blows my mind how simple it is down there. I know it's expensive, but it is very cool how simple it is. But anyways, so went down there, got the test, found out I had the microclots, quite progressed. I was stage 3.5. And so they were immediately going to act on triple therapy, which basically means 3 different types of antiplatelets and blood thinners to try and break all that down with a lot of supplements. His clinic has a very holistic approach in terms of food, mental health, everything. They don't take one approach, but the triple therapy is incredibly high risk. Canada is well known for trying not to take liability on if they don't have to. So my former GP had an emergency and left the field at that time. And then I found a new GP who I got very lucky. He had actually spent 2 years working in the long COVID ward in Saudi Arabia before he came over here. So I was very grateful he had that background, and he fought so hard to get me treated in Canada. He went to his college of professors. He went to the board. He had 3 separate meetings, provided them all of the info, and fought that she has to get this treatment or she's going to have a stroke and die. And at the time, Dr. Vaughn, based on similar cases, had let them know there was, if I had not been treated quickly, there was about an 85% chance I was going to have a fatal stroke very soon.
Oh my gosh.
So very lucky that we caught it when we did. Sorry, it's still weird to me to know I was that close.
That's
So he fought so hard to get me treated here because even though the triple therapy is high risk, the risk of me not getting it was
well,
way higher.
yeah.
And the college acknowledged that. They agreed that, yep, she absolutely needs this therapy. And then they declined me based on risk.
Risk of the actual treatment.
I was not able to get direct, straight info, but what my medical team finally broke down and said is, if we're being honest, the decision wasn't about your health and it was about politics. That's what I was told verbatim.
Okay.
So that's where I said, okay, well, we have to go down to Dr. Vaughn. Couldn't really afford it, to be honest with you, but we're like, you know what, I can't afford not to. So we'll figure this out. So we went down to the States and got treated by Dr. Vaughn there. So we would go down, get my medication, do any lab work that we needed, and did that for about 6 or 7 months in the States. That was sort of the first major treatment that I had.
Okay.
Yeah. And then, so as I did that treatment, they did a lot of different things. So a big one that they're using is something called nattokinase. There's a sort of heavier dutier form called neprinyl. And in addition to the triple therapy, they got me on that. Blood thinners, I had learned, they're more preventative, so they can have a secondary impact of thinning clots, but they're not actually very good at it.
Okay.
And this nattokinase, the best way I can explain it to people is if you take it on an empty stomach, it's like Pac-Man in your blood. It'll just go chew up all the clots and stuff in there. So that was the sort of second form of treatment. They had diagnosed me with, chronic fatigue syndrome, as a lot of you have, POTS, which, funny enough, I don't qualify for POTS in Canada, but I do in the United States. Okay. So that was interesting to me.
Then. Okay.
Yeah, so I find it very interesting how much I've learned a lot about how different the criteria is for a lot of things in both countries. And that's been very interesting because I have very differing medical files in each country, which has been, and they're sharing. So it's been a very strange process with a lot of needing to get letters explaining things to the mutual doctors. But yeah, so we did the triple therapy with the neprinyl. And then on top of that, most of us are having something called mast cell activation syndrome, which they also diagnosed. I believe you are. Yeah. And so for anyone who doesn't know, that's basically your histamines go completely out of whack and start thinking you're having an allergic reaction at all times. And so you can, with mast cell activation, you can out of nowhere, just all of a sudden have anaphylaxis. You out of nowhere can start
rashes and
absolutely.
Fevers, fatigue, pains with that.
The nauseation,
nausea, vertigo. Yeah, I get all that. The presyncope, all that stuff.
Absolutely. And I remember at one point it got to where my body was always trying to cough, which a lot of people with long COVID are getting. And it would get so bad with the mast cell that I would cough and then immediately choke and throw up. Like, it was gross. My poor husband, we'd be driving down the road and I'd be like, pull over right now. But so then they also started putting me on, it's an asthma medication. It's called ketotifen. We have it in Canada. It's not as used here, but we're pretty archaic here. We don't like to change things for 20, 30 years. So, and ketotofen's a newer antihistamine asthma med. I love it. I've had to take allergy meds my whole life, and it's one that after taking it for a month, I have to take 4 of them a day plus a Claritin. And I have no drowsiness. I wouldn't even know I'm on anything, but it is having a drastic issue on the mast cell activation. So I'm not, I'm not reacting to what's that? Sorry.
You're not as symptomatic with the mast cell activation from that.
Yeah. So I remember, you and I talked about at one point how you start reacting to every food that exists. And And that has stopped since then. I'm
Okay,
starting to be able to eat foods I couldn't eat for
that's
the last
good.
couple of years.
Okay.
So that was sort of all of there's a lot to the treatment. Those were the big ones. And then following the triple therapy, when I finished it, so we got me down to stage 2 microclots, which is as far as I'm aware where I'm still at now. And then we did something called EBU. It's extracorporeal blood oxygenation and ozonation.
Mhm.
Basically, it's like hemodialysis. They clean and filter your blood, but while they're doing that, they're adding ozone and oxygen. I didn't notice a big impact physically from that, but my cognition
Yeah.
spiked. I got back to, I'd say, about 80% if I'm not tired.
Okay.
Brain fog's still there.
Okay.
But yeah, when we, this diagnosis is a never ending process, I feel like. I mean, I'm 4 years in and I'm still getting diagnosed every other day. So we did all that. I wasn't as well as I should have been at the end of the treatment. And they were trying to figure that out. And so the next step was to do a pelvic MRI with and without contrast, because
Okay.
they found there's something called the iliac vein, one of the two. They're the main arteries that run down the body, for those who don't know.
Mhm.
And they are responsible for the blood return to the heart. The left iliac vein is what pumps the deoxygenated blood back up to the heart to get some oxygen in there. And that in general, in the general population, it is common for it to collapse, not usually enough for people to ever know, not usually enough for it to be symptomatic. But in long COVID, they're finding it's
Mhm.
overrepresented. So they did the pelvic MRI. Sure enough, my iliac vein that from previous scans sits at 12 millimeters is down to 5. And so for some people, if you're not compressed enough, they can do, there's like ultrasound therapies and such they can do to help the vein sort of recover.
Mhm.
Mine is enough that I have to get a stent put in. So I
Okay.
actually have my surgery consult tomorrow for that, which is, we'll say, a little wild at 36 to be having a stent put in, but if it helps me, I'll do whatever I need to do.
Yeah.
So yeah, so then that was the next step. It was, they diagnosed that. They had taken me off the triple therapy, but then I got COVID again, Christmas 2023.
Okay.
I've had it 5 times for the record, and I will say the 3 in the middle, barely noticed them. It was like one bad day, over it in 3 days, no lingering symptoms other than what I already had, no problem. But
Mhm.
the one that December 2023 beat me down hard. It has been a dive bomb since then. And we got 2 stomach flus after, so it's just my body's shut down. But so we've just bumped me back up. I'm doing like a half version of the triple therapy, so I'm back on 2
Mhm.
heavy duty blood thinners plus the nattokinase,
Okay.
getting the surgery, and then their goal after that is to do some more of that EBU because it helps clear out everything they're breaking down.
Mhm.
And then they would like to see me do some hyperbaric. A lot of people are having really great results from hyperbaric, not lasting results, unfortunately. You kind of have to keep going,
Okay.
but apparently it's helping. So, anyways, that's where we're landing now. Very long winded roller coaster of a story so far, but that's sort of the main overarching umbrella of what the diagnosis and treatment started with.
Okay. I have a question for you. So, can you do me a favor if you can think about it? Can you give like a brief like a kind of like a visual of where you were at your worst, like what that day looked like compared to where you've come, like what a day like
Yeah.
today, like you can even do like a good day then and a bad day then, and then just compare it to a great day now and a normal every day. You know how you are, because
Yeah.
I'm always symptomatic, but I
Yeah.
have my highs and I have my lows, just to
Yeah.
give an idea, because I think that comparison will be very helpful for in so
Yeah.
many different ways. So lots
Absolutely.
of that.
So, I'll start with prior to having long COVID, my normal day was to get about 6 hours of sleep. And then I was an Energizer bunny from about 5 a.m. until about 11 p.m. And I would literally go, go, go. Like I'm talking, I would sit on my couch for a movie maybe once every 3 weeks. And I
Mhm.
didn't stop moving. I was either doing a physical activity or at work or with friends and family or doing another physical
Okay.
activity with my
Okay.
dogs or whatever. Then when I got COVID, when I was at my absolute worst with COVID, I was literally sleeping about 20, 22 hours a day. The most I could do was try to get food in me and
Oh,
make
yeah.
it to the bathroom. That's about it. My family had to help with everything. Like I couldn't get up or move without being lifted by my husband physically. Um, I could not cook, could not dress myself, could not shower, wash my own hair very successfully. Literally, there was almost nothing I could do outside of like my husband would have pre-cooked meals in the fridge. And if I was lucky, I could get there and manage getting one in the microwave and warmed up. That was
Mm-hmm.
it. My best days at my worst were that, but maybe I could get 2 meals from the fridge by myself, or maybe I could have put clothes on. And that was it. That's as far as I could go. Fast forward to today, which there's other strategies and tools I'd love for us to chat about for those who can't access treatment. But fast forward today, I would say pretty much every day I can operate on about 8, 9 hours of sleep unless I have pushed myself into a crash. I can get about 8, 9 hours of sleep. I'm awake for the rest of the day. I don't even need naps anymore. I'm still fairly non-functional when I'm awake. So like getting up and putting my makeup on and getting dressed today, I will probably need a good 4 or 5 hours after this conversation before I'm very functional.
Mm-hmm.
Um, but I can do on my best days, I can do a good 1 to 4 tasks in a day. Keeping in mind a task is like having a shower is like 3 tasks.
Yeah.
If anyone is familiar with spoon theory, if you're not, please look
Yes.
it up.
Yes.
But
I just
yeah,
started it because
it
and
is.
it's like a visual for pacing.
It is. Yeah.
Very
So
good.
like I know a shower is 3 of my spoons of energy for the day. So if
Mhm.
I only start the day with 5, I have to really be
Yeah.
calculating.
Yeah.
Eating, as you know, eating is 1 to 2 spoons, or it's
Yeah.
really hard on the body when you're going through this.
Yeah.
But yeah, so a good day I can do, I would say, I'm going to say 2 to 4 tasks in a day. And I do like my hygiene is still massively suffering. My house is suffering. Thank you to my family and friends for helping
Mhm.
because it like if I want to go and I do want to say on my best days now, I can go for about a 15 to 20 minute walk to the end of my driveway and back. And I have to go slow and monitor my heart rate and my breathing,
Mhm.
but I don't have to stop anymore
Okay.
on my best days.
Okay.
So they're very good considering. And my cognition on my best days, I don't have issues anymore. It might be a little ADHD still, that's not going anywhere, but manageable. On my worst days now, when I really crash, I do get back to I have to sleep all day, but it'll be like 15 hours and I'll have like 3 to 5 awake hours. I'm not functional really in that 3 to 5 hours. Like I still need help with getting food or whatever. I might have to not get dressed because it's that or eat. If I get dressed, I don't have enough energy left to eat.
Okay.
But not like it was. Like I can get bad enough that my husband has to help me out of bed and stuff, but like I have to really, really overdo it to get to that point.
Okay. And another
So
thing I was going to say is that as you're talking about this and what I'm slowly realizing, I think you'll agree is that everyone in general, in whether you're ill or not, you have this amount of energy that your
yeah,
body naturally has, right? So yours used to
yeah,
be go, go, go. I was the same.
yeah.
And what I'm
Most of
noticing
us.
now, because I'm trying a new supplement and I have to remember, I'm like, my husband said, did it give you energy? I'm like, you know what? Wait a minute. It is true. It might perk you up, but the problem is you're only given this amount of energy. So if I'm like, wow, I feel really energetic, let me do it all. I don't have any left over but when you're a regular healthy, even if you use it all, you still have a little like gas in that tank.
Yeah.
I noticed, like, of course,
Yeah.
like if somebody overdoes it that has nothing wrong with them, they're like, oh, they'll rest, watch a movie on a Saturday morning instead of mowing their lawn, and then they've recharged and they're great. For us, it's like, I feel like for every hour of energy I spend, I need 4 to 5 hours to recover, to
Yeah.
refuel. So
Yeah.
it's crazy to think that way, but yeah, as we're talking, so the whole spoon theory is so important and very difficult to follow in the beginning because it's a different pace. So I've realized that I'm only given this amount. So if I look at the spoons as my energy, it's all I have. If I just used them all to do 3 things, there's nothing left. And then I'm borrowing from my next day. And then no wonder I'm out for 3-4 weeks laying down all the time. So
Well,
you feel the same?
yeah, and I was going to say that I think something people really need to understand, especially if you're supporting somebody with long COVID, is when you have the healthy energy, let's call it,
Yeah.
those people can even push through. When you have no energy, you can push yourself and make yourself exhaustedly push through something. The long COVID body literally won't let you. I always tell people it's like it feels like a narcolepsy because it will literally, you'll just fall
You
asleep
start
doing
malfunctioning
something.
too. I
Oh
start
gosh,
getting
yeah. And
like,
you,
that's when the vertigo, all these weird like neurological things start
yeah.
happening. And then I'm like, oh no, I'll say like, I have to stop. Like, I don't have a choice because my body's stopping. Even though
I
I'm
had one
trying not.
doctor explain it like you all of a sudden get hit with a flu and a panic attack at the same time.
Yeah.
It's like if you had your worst, like H1N1, whatever flu, and you got hit with that and a panic attack at the same time, that's the crash that you get. And you do like, it's God forbid you're cooking on a stove or driving or something, and you have to be so aware because if I remember the first time that mine got bad to not be safe driving, I had been fine driving. My brain fog hadn't got bad yet. And I got very unlucky that it happened in the car, but lucky nobody else was on the road. And I was driving down the highway to go home. And all of a sudden I went to take my exit and I couldn't remember how to turn on my signal light. And then I couldn't remember which one was left or right. And then I was like, oh, okay. And then I was like, I need to turn my radio off so I have more focus. I can't remember how to turn my radio off. So I got myself pulled over, thankfully, and called my husband. But if you don't manage your spoons, you can be fine all day. And then just out of nowhere, your cognition's just gone.
It's scary because it is,
It's
there's
terrifying.
been times where I had my kids in the car and I got right to the exit of my neighborhood and I stopped. I'm like, where are we going? And they think I'm
Yeah.
like, no, where are we going? And they're like,
Yeah.
small Publix. I'm like, okay. And then I get there and I'm thinking, I need to get home. Let me just get this done and cause it's sudden because I felt okay. And then it was just suddenly, I literally didn't know where I was going, or I've tried to go to a doctor I've been to 25 times and I'm driving around. I'm like, oh no, where is it? And I have to Google my way every time now because it
Yes.
happens at the drop of a hat, even though it's like the stuff that I just normally do.
Yeah.
You know, and I'll even if I show up late, I'm like, I'm so sorry. Like, I don't know how and your mind is young,
Yeah.
but you feel like, where did that go? Like
Yeah.
and
Well, and my understanding from the researchers around it, because Dr. Vaughn's clinic is doing a lot of the global research with on long COVID. That's one of the reasons I went through them. And he was saying a lot of it is oxygen deprivation because with the venous issues happening, if you're not getting enough oxygen to those areas, obviously they're not going to function. But that's also, they said, why it's so erratic. So both him and a girlfriend who's a paramedic here had said, for example, I had told her, I was sitting with a girlfriend one day and I'm talking to her. I feel fine. And out of nowhere, she was like, I need you to stop and take a breath. And I said, what's up? And she said, your lips are completely blue and you look like you're going to pass out. And I was like, I feel fine. I feel great. So I mentioned this to my paramedic friend. And when I had gone to the hospital, my blood oxygen was like 74. I should have been in the hospital. That's theoretically by textbook, I shouldn't have been able to be functional. I should have been dying, but I was fine. And so what they were, from what I understand from some of the research, is because they're learning it's one of those, it's like this monster running around your body and he doesn't like to sit still. So he's here today and there tomorrow and whatever.
yeah.
So your blood oxygen in your face might not be there, but your lung oxygen still is. So you're fine, but just these organs and tissues are not working. Like it's the weirdest thing. And it's, to your point, the other piece of it with the spoons is, so like you and I believe are both on low dose naltrexone, which, oh my Lanta, I know it is controversial to a lot of doctors because it's still fairly new for that type of use.
Yeah.
But its support of the autonomic nervous system is phenomenal. And I know it doesn't work for everyone, but for those of us it works for,
I've
it
been on
has
it for 3
given
years.
us
Yeah.
Yeah.
without it, because I've even tried to wean off. I'm like, nope, can't do it. I'm
Yeah.
on 4.5 milligrams.
Yes.
It
Yeah.
helps a lot of things like the pain. It's like it turned on, like if you have heavy metal music and it turned it to like elevator music, basically in
Yes.
my
Yeah.
nervous system of panic.
Yeah.
Because even if my mind is calm, my body's constantly
Yeah.
inside, because it's like somebody just went in there and like took the directions away from my body, and I was trying to figure out how to like work.
Yeah.
So the LDN for some reason is like, all right, everybody, this is how we do it. It just seems to
Yeah.
function and flow better. I don't understand the science all behind it, and they're still working on that. But I tell you what,
Yeah.
it helps me a lot.
Yeah.
It helps me a lot.
Well, when you bring up a really good point, because in relation to spoon theory with all of this, like the average healthy person, they have ample spoons, and like let's say they have 20 spoons a day and they don't use 3 of them, they get to roll those over to the next day. Our bodies
Yeah.
don't. Our bodies don't ever have excess spoons. We actually usually don't have enough, and that's why we go into these crashes and flares. But then in addition to that, like when they go to bed and they get sleep, let's say they have a very bad day, they have stress at work, they broke up with their spouse, whatever, and they're in fight or flight. Their brain will often, when they get sleep and get that rest and get that calm space, their fight or flight will calm down for a sec. And it'll only go up when they're engaging in those stressors, and it'll come
Mhm.
back down. But for all of us with um, something like long COVID or chronic fatigue syndrome, fibromyalgia, any of
Yeah.
those autoimmune conditions, your body stays in that fight or flight for so long
Mhm.
that it actually can get to a place where it essentially forgets how to turn it off.
Oh
So now
yeah.
you're living this state of your body that is consuming your maximum energy, that is supposed to only be when you have a threat that you need to address. We're operating in that all day, every day. So that task that could
Mhm.
maybe take you 1 spoon if your nervous system's calm takes you
Mhm.
4 or 5 because your nervous system's doing it
Mhm.
under this stress and pressure, right? And I found the LDN helped a lot with that
Oh yeah.
because I'm operating at a calmer state at all times.
Yeah.
And I think
Definitely.
that's what gave me a lot of my spoons back. Like I know the triple therapy helped,
Mhm.
but the LDN had a huge impact on that.
Yeah, and I know for me personally, it is because it's the only thing that I took. There was the first thing I took after Cymbalta, or there's another name for that one. I can't remember.
Oh, it's not coming to me right now, but yes.
Yeah, they put me on that, and it didn't work for me personally. It just, my body chemistry didn't work, and so when I did the LDN, it was the first thing that actually did something, and then
Yeah,
it made a huge difference. And I was able to like then incorporate the like do the physical therapy, and it allowed me to be able to do the
yeah,
things to actually improve until I got COVID, and then it caused me the mast cell activation,
yeah,
the worsening migraines, and then the chronic fatigue syndrome, and then the fibromyalgia was worsened along with all the
yeah,
gut conditions. Everything just became worse.
yeah,
But the LDN, as much as I thought like it wasn't still working, without it, I'm even worse. So I
yeah,
know that I really need to stay on that. So LDN's great.
yeah,
I'm going to put links to all these things we're talking about so you guys can check it out for yourselves. But yeah. So,
yeah.
what do you want to kind of close out with? And you can go into depth on it. Do you want to talk about the healthcare system or more of your treatments or what you were saying, like the therapies and things that could help people? Well, I guess like obviously the LDN and the spoon theory for sure.
Yeah, I was gonna say a little bit of both because spoon theory, I do want to get into some pacing. I will say that biggest thing is like we talked about briefly, like because there isn't enough research going on, first of all, we need people's voices. There's something like 65 million people in the world dealing with this. In Canada, the most recent numbers said something like 2.5 million people are off work here. Keeping in mind, for anyone who doesn't know, our entire population in our country is the state of California. Literally. For you guys, it's something like 11 million people in the States who are off of work because of this. So that's impacting the economy, that is impacting families, you name it. Um, But that also means there are even the treatment options there, like Dr. Vaughn's clinic is absolutely phenomenal compared to the cost of care in the US. He is making it as affordable as you possibly could. But even for what is there, they're not cures. First of all, people need to know that there is no cure. They are clinical trial treatments, so they're not approved. So the likelihood of getting covered for it is zip.
Mhm.
So even though they exist, unless you are willing to go in debt to try, which we were, or you can scrounge up the money, most people cannot afford to do the treatments.
Mhm.
And if you're not getting supported by your system, like to be 4 years in and for them to not have approved anything for this, they haven't approved the LDN for it. They haven't approved
I know.
the nattokinase, even though millions of people are using it and getting at least a little better. Not enough, most of us not enough to get back to work, but or the ones who are, I've noticed a lot are only getting back part-time, but enough that you're a little bit more autonomous, a little bit more independent. But if you can't access those things, you have to have other tools.
Mhm.
I have the luxury of in Alberta, we have a long COVID clinic. Our whole country had them. And then right after supposedly putting $5 billion into long COVID research and support,
Okay.
like a month after that, all the clinics got closed except for Alberta. So I'm curious where that money's going because we're not seeing it. But the clinic in Alberta was amazing because they're teaching people the number one most important thing with any of these chronic conditions is pacing, as you've said.
Mhm.
And for those who don't understand spoon theory, it's basically figuring out what is your average amount of spoons that you can use in a day amount. You can look at them as marbles, tasks, whatever.
Mhm.
And I know that was huge for me. And when I was off work and had the time, what my neurologist did that was wildly effective because I kept trying to figure it out. But same as you said, you'd have that one good day and you can't help but overdo it because you're trying to catch up. You're trying to feel like you're living again. You're trying to
Yeah.
feel like you have your life a little bit.
Yeah.
And so what she had me do is she said, okay, what's your absolute worst day? And at that time I said 1 to 3 tasks if I'm lucky. And she said, okay, so every single day you're going to do 1 to 2 tasks. That's it. And that was tough because it meant literally my family had to continue doing everything for me. I couldn't get my own meal. I couldn't put
Mhm.
clothes on. I couldn't. So we did that. But what we did is that stabilized me because for those who
Mhm.
don't know, those crashes, the post-exertional malaise crashes is what they're called. They can take anywhere from 24 to 72 hours to hit your body. So your day before
Yes.
isn't always what made you crash.
Yes. And you're like, well, that didn't do as much as I thought. And then about 48 hours later, I'm flat out for 3 days. And that's,
Yeah.
yeah, because I work a
Yeah.
little bit, like 9 hours a week. And sometimes right after work it starts, but then sometimes it's like about a day or two. And I'm like, oh no, it always
Yeah.
happens, like you're saying. So that makes 100% sense. So,
Yeah. Well, and so that's why I liked what she did is she had me start at the 1 to 2 tasks a day and just stay there. She said a week, 2 weeks, however long it takes to not be in any sort of a flare, to be at my best, basically. So I did that. It only ended up taking a week. And then after that, we just added 1 task a day for a good week or two. So then it was 3 for a week, and then it was 4 a day for a week. And then I learned that 4 seems to be my absolute max. If I go past that, I will crash. I'll be out for a week. I used to crash so hard, in all fairness, I'd be out for 2.5 months. That was the worst ever, or weeks. So I do want to let people know, like when you do this pacing, I went from crashing for a couple weeks to a couple months down to my worst case scenario now is I crashed for 3 or 4 days.
okay.
So
That's kind of where I'm at. Yeah.
yeah, that pacing is so important. It's probably one of the most important things you do because one of the other things you do need to do is move your body. This is largely vascular, they think.
Mhm.
In general, your body needs movement, but post-exertional malaise is such that it has the opposing effect where when you do aggressive exercise, you actually damage your body and your tissues start to engage in things like necrosis. So actually, for those who don't know, Dr. Wust out of Amsterdam just did an actual biopsy-based exercise test for post-exertional malaise in long COVID and healthy controls. It was a small scale study, but phenomenal results. And it looks like they are trying to replicate in a larger study now. So curious to see where that comes from. But so you do have to move your body, but I've learned you stick with gentle, 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 like I do senior swim classes and I do them at low capacity. If you go for a walk, it's slow and you keep your heart rate down. If you do swimming, I've had controversy, I don't know about you, from doctors about the bike. A lot of them don't like it.
The stationary bike.
Yeah. In general, I'm being told if it's vascular, we don't want to see you on the bike as much. We'd rather swimming, walking, gentle yoga, that kind of
Everybody
thing.
tells me walking, swimming, yoga,
Yeah.
Pilates, you know, the
Yeah.
the gentle flow movement and slow.
Yeah.
They're like, start with
Yes.
5, take a break, start with 10. And actually there, if anybody's watching, there is, if you look on YouTube, there's a couple of fibromyalgia workouts. What they do
Yes.
is it's like it's basically like a floor Pilates stretch combination, but
Nice.
they go slow, but they take these little breaks in between rather than like going straight through and resting, because we can't do that. And
Yeah.
so it helps you actually complete the actual task.
Yeah.
So it's
Which,
like,
well, and you're bringing up a good point too, is the rest, because even when you do rest, a lot of us qualify rest as like sit on your phone for a second, look
no, it's like
around.
nothing. Yeah.
Yeah, like stop the workout and go take a glass of water. And it's no, your rest, like your
Lay
whole
and
sensory
breathe, move.
system,
Yeah.
shut it off.
Mhm.
Right?
Mhm.
But, and that's, yeah, so that's, I think, a big one for people is learning like, well, so all the research seems to be finding that the majority of people with this severe version of long COVID are athletes, which, if their info on post-exertional malaise is correct, makes sense, because what do most athletes do when they're struggling? They work out to recover. And so we may have been damaging ourselves. We'll find out. Research will tell. But most of us, what we know for being healthy when you're trying to recover from something is like the opposite of what you have to do in long COVID to be healthier. It is the
Yeah.
weirdest transition to get used to.
Mhm.
But I will say too, a big one I've heard lots about that I know has been huge for me is electrolytes.
Oh
Holy
yeah.
cannoli. Oh my God. I
Everybody, it's
got put
helping
on,
everyone. Yeah.
what's that? Sorry?
It's helping.
Yeah.
And it help, you know what I notice it helps is the nausea, the gut, for me personally, the nausea, the gut
Yeah.
pain, and the vertigo.
Yeah.
I don't get as many episodes as extreme, and the headaches
Yeah.
too. The hydration, and then what do you know about it? Like what?
Well, what I've been told so far, and my all of my testing has shown this both in Canada and the States, the liver and kidneys are really struggling, as they often do with chronic illness.
Okay.
So I do know a lot of people too, upping your hydration, whatever amount you needed before, add a liter.
Yeah.
Obviously talk to your doctor, but most of us need more hydration because our kidneys are just really struggling. That's where the electrolytes can be great. I got put on, Dr. Vaughn's clinic introduced me to one called Relight. You can get it on Amazon. It's my favorite.
Okay.
Within 20 minutes of drinking it, I feel more energetic. I just feel more refreshed, more,
Okay.
and it's not too expensive comparatively. But yeah, the liver and kidney seems to have a big impact, they're saying, in relation to why we are needing more electrolytes. I find I've always done the eating where you eat smaller meals more frequently. I have to stick with that. If I miss a meal for too many hours, my body just dive
You feel
bombs. I
sick
have
and
to have
shaky
that
and
energy.
stuff. Okay.
Yeah, I don't, and that they haven't said much about. They've just said you have to kind of keep eating. Gluten and dairy, for those who don't know, are massive triggers for mast cell activation
Oh
and
yeah.
histamines. So even if I'm not intolerant to either, but they said you have to limit them because they can really trigger those. And again, it's really important for people to understand, if you have mast cell activation, I've learned a lot of people are not getting told, you can have anaphylaxis from it. If
Oh
you
yeah.
don't manage it, yeah.
And there's a stomach version of anaphylaxis, whatever. I can't pronounce it right. But yeah, there is a different version of that. And somebody was talking about this where it can almost cause like a stomach upset type of thing. It's not even in your esophagus, in your throat, or anything like that. It's strange. I didn't know that.
There's a girl I follow on Instagram who has POTS, and she had just posted yesterday, and she was saying she was having a decent day, recovering, went to the beach by herself, was hanging out, having a relaxed day, and then she's trying to get home, and out of nowhere, a mast cell digestive attack hit.
Mhm.
And it was like in a split second, she had the worst stomach flu of her life and couldn't get home fast enough, kind of thing.
Yeah.
It is like, yeah, the managing diet is huge. And
Mhm.
I'm a big believer too, and I know you also are, the mental health piece.
Oh
That's,
my
I think,
gosh, yeah.
undervalued too much. The mental health and the faith piece are so important because
Yeah.
there is this immense, immense mountain of grief and loss every single day of this. You're going to lose friends and family. You're going to lose autonomy, access,
Mhm.
your careers, your lifestyle, your hobbies. Like,
Yeah, you feel like you lost yourself really in the
you
beginning.
do.
You're like, who is this? This isn't, I don't want to live like who wants to live slow?
Yeah.
I feel like I live like a lifestyle of like a retired, very elderly person that is
Yeah.
very calm and slow, and that was never me. And I've had
Yeah.
to learn, but there's a lot of benefits to slowing
Yeah.
down. For me
Yeah.
personally, it's been probably in the long run, it's probably healthier for a lot
Yeah.
of things for me to not be as insanely go, go, go. Like I was like crazy go. I like just
I am
never stop,
hearing,
like you're saying. So that's not good either. But even
I'm
though it
hearing
feels
that from
great.
everyone. Yeah. Like everybody I've met with long
Yeah.
COVID was the go, go, go birdie. And
Yeah.
they're all like, wait a second, it can be nice to stop. Like it takes, I find for most of it takes a year or two to like actually
Yeah.
let yourself accept and settle into that. But once you do, you're like, wait, I can just like sit with my family and watch a sunset at dinner. What is this?
I
And it
know.
is. And it's funny. I always tell people I got reamed out on the internet once because I posted a video and said, there's a lot of blessings I have pulled from this. I was the burnout queen, always on the hamster wheel, constantly sick from it. Even for how healthy and fit I was not living a sustainable life is how I like to say it.
Mhm.
And I am probably the stubborn person who needed something like this to knock me out of it. So I don't wish this on anyone, but I can tell you there's a million blessings. And you do like you have it gives you a different, you really reprioritize your life. You think you have your priorities straight until something like this takes everything from you and
Mm,
takes option and control from you.
yeah,
And when you have that one spoon a day that you have to be so careful with how you use it,
I know.
you really start to redefine what matters to you in life and what you
Yeah.
want. And so to your point, like we kind of start finding ourselves again, but I don't think we're ever going to find that version we had before. It's like
No
you're
way.
crafting a
No.
new one, right?
Yeah. Yeah. And on the mental health thing, if you could find a way to get it covered or afford it or whatever,
Yeah.
I personally, when I first went to someone, it was because I was having a hard time handling it on my own and I didn't realize I
Yeah.
was grieving, and I was like, I wasn't getting better. So I was okay if I was going to heal it and cure it, but I wasn't. And I went to that person and they helped me understand like, oh, you're grieving. Cause I never thought about grieving while you're alive, like over
Yeah.
yourself, so it
Yep.
is a thing. And it's very important what I'm learning in therapy is that the grieving process is important to actually get to the acceptance of this may be it,
Yeah.
and
Yeah.
if, how am I okay with that? And how can I be more than okay with that? And that's kind of where I'm at. And my therapist, actually, we're working on the spoon theory, and she was doing the same method where she said, you got to find your worst day and use those spoons and build. So eventually I'd like to get to that point. It's hard on the days that I have to do the working, but on the other days I'm learning, and it's not easy. Even if your body can't do it, you still want to, you gotta, your mind and your body have to start like working together, because I was fighting my body because
Yeah.
my mind was like, no, I'm good. And so I
Yeah.
mean, if my body was on the floor, I'm like, well, I'm crawling to the kitchen and make dinner.
Yeah.
Or if I had a
Yeah.
migraine and I'm wearing blackout sunglasses, Zofran, and crying with medicine, I'm like, I'm cooking that dinner. I'm going to do this or that. And sometimes you have to just say like, okay, body, you win today. And
Yeah.
just, you can only do what you can do.
Yeah.
Even if your mind
Well,
tells you. So the mind over matter does not work in this
no,
situation. And
no.
I've had doctors tell me, now you just got to get in there and and they don't know. And then the ones that know, they're like, no, you need to stop
Yeah.
and you need to do
This,
this.
and the most frustrating part to me about that is that this is like chronic fatigue syndrome, fibromyalgia, they have been around for decades. We have known that this is how you have to manage chronic fatigue for decades. And it blows my mind that we know that's the most sort of common, one of the most common symptoms of long COVID. And I'm actually, quite frankly, really disappointed and appalled at how many doctors have no awareness of that.
No.
And you hear about, you hear about, and I have heard about for decades about people feeling like they get lost in the medical system, like they're not seen or heard.
Mhm.
And that's why is they get these doctors who, especially, and I hate playing the woman card, but I know that as a woman, especially, it does happen to men, but it is especially common for women. God forbid you are seeing a psychologist or have anxiety, because a lot of doctors will look at you and go, it's all in your head then. If you having, it's like they have this perspective of, if you have anxiety, it means you couldn't possibly have anything else because you have anxiety. So you're creating this for yourself. And
Mhm.
your only hope is to have it on record that that stuff happened before the anxiety. And goodness forbid if you gain weight. You gain
Mhm.
any weight, which a lot of these disorders cause,
Mhm.
you are immediately told, oh, it's just because you're obese.
Mhm.
And like for me, it was really interesting because when I got sick, thank God I was like rock solid muscle, head to toe kind of thing, not an ounce of fat on my body. And I'm so grateful because the amount of new doctors I go into who they play that card. Oh, well, you just need to lose weight, which is super easy when you have an illness where you can't work out.
No.
And the food, like I find, and probably because my body is struggling so much, it won't lose weight based on diet right now. We've tried, it's not working.
Mhm.
And had I not had that record of, no, I was fit and healthy for 2 years before I had seen my doctor every month, and thank God, because I could show them I was here and then 40 pounds in 1 month. And then I stayed there
Mhm.
because it's so many people have
Yeah.
that experience of not having, or like in Canada, people who try to get the doctors, like if you want to get into a psychologist who can support you with that pacing
Mhm.
or chronic fatigue management, the average wait time in Canada right now for a covered, like an Alberta Health or whatever
Mhm.
province you're in, covered health care psychologist, psychiatrist, etc., is 2+ years.
Wow.
And you can't wait that long because you're
No,
deteriorating that whole
no
time.
way.
But that's where I will say, like, the COVID forums on Facebook are amazing. And not to mention just having community, having that social connection with people who actually understand is so important in this.
Mhm.
And those communities, you can get so much info from the people actually living it, right?
Yeah.
And see, because I was, sorry, I'm bouncing all over this morning, but to your point with the spoons, even once you get it figured out, it's a job every day. You never have it figured out because if you have a little bug you don't know you're fighting, or you have a surprise visit at your house, or you're driving and someone does something chaotic, there's all these little things that you can't be prepared for
Mhm.
that steel spoons you were earmarking for something
Yeah.
else. So it's but it is the, I believe, and from what I've seen and heard, the most important part of this is that pacing, community, all of that. And I mean, to that point, asking for help. I'm
Oh,
laughing
yeah.
because most of us were the go, 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 independent, do
Mhm.
1,000 things a day people. And most of us really suck at asking for help.
Yeah. And our
Or we
family
feel like a
members,
burden.
yeah, we're used to that too.
Yeah.
And like my husband doesn't look at me like, why aren't you doing all the things you did? But I was the hardest on myself. But
Yeah.
um they do I'm sure that they, as much as they may, some people are more supportive than others. Everybody has their time. Like it took me almost 5 years to accept this.
Yeah.
The long COVID, all the other, the fiber, all that. And then
Yeah.
my husband took his time to like comprehend and get it and
Yeah.
support. And, some people, I was interviewing someone and they basically saw a few doctors, got their diagnosis, and they were like, okay. And they, like accepted it. I was like,
Good
that's a
for
thing.
them.
That's a thing. Oh, maybe I should accept it, because
Yeah.
everybody is, and if you accept it right away or you push and you like fought to the last, degree, it doesn't mean that anybody's more successful or less, or
No.
you got to do what you got to do. If it's going to take you years to accept it, that's you. If it's going to take you one doctor saying you have, you're like, okay, this is me, it's fine. I mean, you got to, you are you. And
I
I have to
think
understand that.
too, well, and I don't think that's a linear journey. Like I can tell you for me in the first 2 years where I could still go to school and do work, I accepted it fully. I was like, okay, it's just something I manage now. Like it sucked in the terms of it was a little bit fear provoking just because we didn't understand it. But as long as I could function and be fairly independent, it didn't bother me. I was like, this is very common for people to get chronic illness, especially our generation. Very common as you age to have pains and aches and this and that, and whatever. So it didn't bother me that much until I had to stop working.
Mhm.
And for multiple reasons. Number one, we can't afford that. Number two, I love having purpose and I'm driven. And like you said earlier, a lot of people think that when you're not doing something, it means you've given up or you don't want to. And you're like, no, you're sitting there in this like paralysis because your body's shut down and your brain's going, but there's these 20 things I'm excited about doing
Mhm.
today, and you can't go do them. It's horrific. And that I find is where, so I 4 years in, and yet I'm new to learning the acceptance piece because it didn't bother me till I lost my autonomy and lost my ability to work. And I find for a lot of us, it's not linear. It is sort of you're meeting your illness every day. And every day you have to start your day meeting your illness, checking in where both of you are at, and just working with that every day. You have to be so flexible,
Yeah.
so adaptive.
There's no plan. There's no, like I've learned,
You
like
know,
I planned everything. By the
yeah,
15 minutes, I'm like, well, here's my what I'd like to do, and I know that it may or may not get done, and it's
yeah,
okay. If I'm supposed to go to a party, I usually don't make it. I mean, I just do what I can, and I have to learn that that's all right. So
yeah,
I've gotten so used to it. So if you are new to this and you're like, well, no, I have to go to all these things and do it all, like you may not be able to do it. And believe me, one day you might just say, it's okay.
yeah,
Because I have to tell myself that, like on the days that I can't
yeah.
food shop, I usually can't. I order my food and I got to drive and pick it up. So then I have the energy to put it away. Or
Yes,
if I want to cook, I know I can't do all the other stuff. I'm going to cook
yeah,
instead, or I'm going to order out, or I'm going to have a leftover because now I want to throw laundry. And like it's like you learn to like wheel and deal and trade
yeah.
your stuff. You just figure it out on the way.
You
So
do.
what do you want to close with?
Well, I think the biggest thing I want to close with is reminding people that you are not your illness, because
Yeah.
especially for the productivity people like us, when you lose the ability to do what you were used to doing, you find out very quickly, most of us through our lives, especially in North American society, we've attached our worth to what we do and what we accomplish. And I think the biggest thing is I want people to start seeing your accomplishments are still there. They're just different now.
Okay.
So if you woke up and ate, you have something to celebrate. If you got clothes on that day, you have something to celebrate. If you were able to get outside with your kids or whatever, and just remembering that this does not define you, this is not who you are, it's just something that you're managing. And even though a lot of us are doing like 10% of what we are used to, and that feels awful, I just beg anyone going through this, if there's nothing else you did, spend the time learning that when you are sitting on the couch, incapable of doing anything, feeling useless, frustrated, you still have value, you still
Yes.
have worth, and the people
Yes.
around you are still so grateful that you're there. They don't care that you're just sitting there struggling. Well,
They're
they
just
care that you're
glad you're
struggling, but
there.
yeah.
They're glad
And
you're
I
there.
think that's the biggest one is I watch on these forums, especially so many people just going through this heartbreak of hating who they are now because they can't do.
Mhm.
And they're like, you exist. If all you did is sit on your couch and look at your kid and say, I love you, your kid is so grateful that you're just there existing. And
Yeah.
especially the parents going through this, like you have to remember that, yes, it's wonderful to be able to do a million things for your kid, but
Yeah.
even when you're not, you are just as important and it doesn't take that away.
It's true. It's true. And they, another thing, if you do have children, and you think like, they're super impacted. They are, but what I notice is that, my children see how hard I try,
Yes.
and they are not having anxiety and sadness. They're having like, for like my son, he's a teenager. It doesn't affect him too much in the sense of like he's worried or anything like that. He sees what I can do and how hard I try. And even my daughter had made a comment to a friend on the phone. She said, "Yeah, my mom's a hairdresser, but it's really hard for her. So she works just a little bit, but she's like really good and she tries so hard." And I was like, "Oh my gosh, she's 12 and she's talking to her friend like that." Like she sees that I try. And
Yeah.
she doesn't look at it like, why don't you work full time and do all these things? And so I think that just seeing your parent like do the best they can and try and push through things, but also like learn to care for yourself and to love yourself and to still have value when you're not doing all those things. It's a good example to them that, hey, mom is still great and mom is still mom and mom is still a person if she's not working full time or dragging me all over the place, you
Yeah.
know? So I
Yeah.
think that's also a good thing, and letting them know enough, but not being a burden too,
I
and
was just
like
gonna
dumping that
say,
out. Yeah, because I don't sit with my kids and explain they don't know every little thing.
no.
But they know enough that they know that I'm changing and adjusting, and I'm thriving and surviving and
Yeah.
and finding a way and having joy in that and trying and also having a struggle. And I think that whatever they do notice is a healthy thing because I'm
Yeah.
choosing to make it that, not a negative in the living room,
Yeah.
just crying all day and woe is my problems, but like, how do I go now? What do I do?
Yeah.
And if you are there, that's okay. You can
Yeah.
you can change that, and therapy helps
Yeah.
that. And
And it's
just,
okay to have those days that
yeah,
you
that's
do
what, like I
have to
said,
do
yeah,
the
I have
work
these.
to, yeah, it can't consume you. It
Yeah,
really can't. And because, like, I wanted to say to your point, because your kids do see. And I think because a lot of parents will try to shelter their kids from it, and I understand that fully. You don't want them to suffer, but they know. They know when things
yeah,
have changed. They know your heart. They know when you are not feeling your best. Your kids notice more than we ever realize they do.
yeah.
And so if you're willing to just give them enough information to help understand,
Mhm.
it allows all of you to just work as a team more, right?
Yeah.
And sort of stay connected through it a little bit more,
Oh
which
yeah.
is, I think, really important because if you're burying it all away and hiding it from your loved ones, they're
They're gonna
sitting in
do the same.
nothing.
They'll do the same later if they have a problem, or yeah.
Well, and not only that, but then they're in pain because they know something's up and they can't understand it and they can't support. So I
Oh
think
yeah.
it's really wonderful to be having those appropriate conversations with your kids and making sure, because you've shown, like, and I think a lot of parents I've heard are seeing that their kids see more than you think they do, and
Oh yeah.
they see it from their heart. That's the great thing about kids, is they see it from their heart and all they care about is understanding.
Mhm.
They don't need you to be super mom. It's wonderful that every mother in the world wants to be, but they don't need you to be.
And I honestly, I don't even think they want us to be. I think we just
No.
want to be it for ourselves, or I don't know what we're doing, but
Yeah, let's be honest. There are phases where they're like, I'm fine. I don't need a parent
yeah,
anymore. We're
yeah. I know it all. Oh, I know.
yeah. Oh,
So
yes. Well, I'm glad though that you're at least finding your way with this, because I know for anyone, it is a long, long journey. It's, please, anyone struggling, like, this takes time. Anyone I know who's at the 4-year point with us, you are never done learning. We
mm-mm.
don't have it figured out. Nobody does. We're in this together. But if we all get louder and use our voice more and push and push and push, we'll get more and more resources as time goes
Oh
on.
yeah.
So
So I'm gonna say this was great. We got a lot of information in here, and if you have joined us and feel like anyone could benefit from hearing any of this, please share. Feel free to do that. We are not doctors. We are not medical professionals. We are patients. We are living with chronic illness, but it is not, you know, driving our lives. But we're working with it to thrive and function and be the best, you know, we can be within our limitations. So thank you for sticking around if you've stuck around this long, and God bless you all, and we will see you soon. Bye.